will take you through my understanding of the concepts and models of health and endeavour to explain how health and illness are socially constructed in our society, and talk about alternative health approaches and explain their implications for healthcare. I will start by talking about the definitions of healthcare from 5 sociological perspectives. I have offered my thoughts on the influence of health and ill health during this section. Then we will look at the concepts and models of health, and finally alternative approaches to health. Outline different concepts and models of health, the scientific method of study. As we look at the wider definition of health sociology, we explore the concepts and models within the context of health. But before we outline the concepts and models of health, let's look at the 5 sociological perspectives and see how they may influence society's views of health and ill health. Functionalism. To maintain stability in society, functionists believe we need to be fit, healthy, and work to look after our families and contribute to society. Becoming sick, leading to a process of evaluation from a doctor and a sick note, thus ensuring us away from work until we recover. This can lead functionalists to label somebody as a hypocrite, work shy, or lazy if they can't return to work with a chronic illness. Functionalists also question the level of trust between a doctor being asked for the sick note and the patient. We perceive the doctor as an authoritative figure. Additionally, not everybody who is ill goes to the doctor, highlighting that the doctors play a key role as gatekeepers to the sick note, thus participating in the sick social control. Marxism. The medical profession has power. Biomedical model of health suggests that ill health is caused by disease or a failure of individuals to lead a healthy lifestyle. They blame individuals when ill health results from social class inequality caused by social influences in an equal society, such as low pay, unemployment and poverty. The Marxist approach has been criticised for the analysis and sees medicine and healthcare as a means of making profit and keeping workers fit for employers. Interactionist. Subjective and based on small-scale human action, not large-scale substructures. Interactionist approaches to health are concerned with subjective experience of health and illness, implying how different people give definitions and meanings to health, and how they experience health and illness depends on their social situations. This social construction is contributed to by the interaction between people, such as doctors and patients. An example is the labelling process, as how people become known as sick by a doctor and patient's interaction. Postmodernists, changing previous theories that are no longer considered fit for purpose, rejecting the biomedical method, model, and scientific thinking in general, claiming instead that other equal valid explanations and solutions for ill health. Postmodernists also argue we now live in a consumer-led culture, where the human body and health are often design projects for people to take control of. Feminist theory. Feminists see women as oppressed and exhausted, excluded, restricted by the society based on where men hold power and women are oppressed. Girls fulfilling society's construct of femininity and boys fulfilling the masculine construct. In the health context, feminists see the traditional medical approach as domineering women. Quite clearly, each of these sociological viewpoints contrasts with the other in their causes and consequences. Let's go on to look at the models of health. The biomedical model. The biomedical model of health underlines Western medicine and is the National Health Service's main approach, seeing health as the absence of disease and ill health arising from identifiable biological or physical causes. The main aim of medicine and modern healthcare systems like the NHS is to diagnose and tackle these physical problems and symptoms. The human body is seen as a machine that breaks down. Doctors apply expert knowledge to fix the issue. Good health depends on trained medical personnel, medical technology and drugs. Medicine and medicine technology, seen as a good thing. The more there is, the better people are. social model of health. Sociological findings mean growing recognition amongst health professionals that poor health results from a combination of individual, structural, social and cultural factors, as well as biological causes that form the core explanation. Many recognise lifestyle choices such as smoking, food choices, drinking alcohol and the amount of exercise people get, alongside factors like low pay, poverty, poor housing and unhealthy environments also influence health. So, moving away from the biological model to a more social model reduced the medical professional's power, influence and the medical gaze. The guiding principle of the social model of health are area. Address all determinants of health. Reduce social inequality, meaning everyone should have access to healthcare. Empower individuals in the community. Provide resources and skills to improve health. Accessibility to healthcare. Healthcare should be affordable, appropriate and accessible to all. Slide 5 is my holistic model. Health and well-being levels are assessed from lifestyle, diet, exercise and stress. With the person being engaged and involved, all individuals' holistic health is not static. They are changing over time, being affected by life decisions and choices. To understand how these 4 aspects operate in the person's surroundings, relationships and environments, this model suggests that health professionals can improve their effectiveness if they look at the whole person, values, principles and environment, and physical and mental welfare. This model is costly and time-consuming. However, professionals increasingly take the holistic view of health to understand the illness. The holistic model emphasises a range of factors contributing to patients' ill health, instrumental in care and management of long-term health conditions. Let's have a look at the concepts. The negative concept. The negative concept is not used in a general sense of being a bad negative, but because individuals believe they are healthy because they are not injured or suffering from a disease diagnosed by a medical professional. The absence of diagnosis and a general feeling of being well evokes a feeling of health and pride in not going to the GP for years. A person defines their health by how quickly they recover. Has your cold gone? Reinforcement that you are healthy again? The negative concept doesn't give the full picture of health. Fortunately, this view of ill health, identified in a negative concept, are rarely now found in health professionals. However, it is still fairly common in the general population. Positive concept. With this model, individuals take an active interest in living a healthy lifestyle. For example, taking regular exercise, managing stress, enjoying healthy social lives and making a conscious and continuous effort to maintain good health. This approach has implications for healthcare professionals. In the past, medicine focused on prevention, diagnosis and treatment, but as we know from the negative concept, health is more than an absence of disease. Positive health promotes people's health assets, positive strengths that can contribute to a healthier and longer life. The concept is more than associated with modern-day thinking about health and well-being. The individual is encouraged to take responsibility, take positive steps to improve their health through diet and exercise, limit alcohol intake, and not to smoke or to encourage less smoking. A positive, healthy nation. And also, this thinking would suggest a healthier nation will also cost the healthcare system less. The holistic concept focuses on the person's mind and body rather than separate parts or symptoms. A strong link between physical, emotional, intelligent and social health and general well-being. While considering the whole person, using the following 4 aspects of health and well-being: the physical health, intellectual health, emotional health and social health. The matter of defining health, illness and disease is not an easy task. What counts as health and illness may vary between individuals, social groups, sexes and societies. Although an extreme example Britons once considered mental illness a sign of satanic possession, a matter for the church, not the doctors. There is no simple definition of illness because, as sociologists would say, for pain and discomfort to counter the disease, it is necessary for someone to diagnose or label it as such. Individuals define and respond to health in different ways. Older people may define good health as not having aches and pains, along with being able to live in their own homes. Young people might define it as being well enough to go clubbing all night. We could also change our views to the state of our health. It depends on our choices and situations. For example, we might be too old to come to college, but well enough to go clubbing. Health and illness can result from an individual, social, media, cultural interpretations and perceptions, or a social construct. The social construction of illness. Researchers study the physical, mental and social aspects of health and illness, focusing on the doctor-patient relationship, the socio-economic of healthcare, how society influences our attitudes towards health and illness. Conrad and Baker in 2010 collected a framework to understand the key search findings from the past 50 years. They separated the findings to the cultural concept of illness. Some illnesses are cultural and not a defined condition. For example, homosexuality, once categorised as a mental illness and now fully accepted in our society. The social construct of illness, how many each individual experiences their illness, i.e. how they respond to and manage their illness. The social construct of medical knowledge, illness and medical knowledge, and developed by stakeholders and those with vested interests in medical companies. Michael Fawcett in 1977 said that knowledge was power. Further, that medical knowledge of doctors gave them power over their patients, though that he term which he termed the clinical gaze. Seeing the human body as a treatable object with little regard for the person. In 1967, Illich started the phrase medicalization of life, when in his findings, everyday functions such as pregnancy, childbirth, aging and dying were becoming functions dominated by the medical profession. According to even Illich's views, a process egogenesis has taken place, where doctor-generated illness culture has formed, resulting in more illnesses rather than improving health. There are several different forms of heterogenesis: clinical heterogenesis, harmful side effects of medical activities and medication; social egogenesis, hypochondriacs culture, people imagining and researching illnesses they do not have; cultural egogenesis, society obsessed with medical appointments and referrals to consultants. We were living in an age of medicalization and a culture of pill for every ill. Pharmaceutical companies make billions from prescription drugs. These companies control public health and public policy, ensuring we live in a culture where the first treatment point is medical. Illich believed that modern medical practice encouraged people to seek interventions, to take drugs they did not need, treating side effects with other drugs that could also cause harm and they possibly did not need. Through social conventionist theories, there is a definite theme. Not all illness is just about a disease. Illnesses are influenced by social interaction, changing knowledge and power. As an example, let us think about some diseases and conditions that are often in the media. Cancer, referred as evil, with patients describing as battling cancer, being a victim of cancer, or suffering from cancer, and described as winning or fighting off cancer, and those who have lost the battle with cancer. Cancer and our preconceptions of all influence a person's ability to manage this disease. Morally judging some illnesses such as obesity, we might say it's self-control issues or gluttony, or drug addiction and alcoholism being labelled as a person's fault for showing a lack of control. All examples given send the same message. We are socially constructing thoughts about these conditions. Coronavirus 2020, a worldwide emergency. Media coverage? Lots of it. In England, the NHS signed up Elton John and Michael Caine for a social media campaign to convince the public that COVID vaccines are safe and effective. So celebrities have more power than the medical profession? Again, this mass media route shows that we are subscribing to the beliefs that health is a socially constructed concept. Follow Elton? Survive COVID? The media surrounding the ongoing health crisis of coronavirus continues to shock and claim our attention. Has the media caused more harm than good? I found this statement in The Lancet. I found it particularly engaging. 2021 Permanent Boycott. The media represents an important bridge between science and society because residents turn to mass media to inform and shape their attitudes, perspectives and behaviours. The media functions as an important interpreter from the formal space of science to the informal space of everyday life. Media stories about the pandemic have been found to have substantial effects on people's beliefs about its origins, opinions about appropriate policy responses, and overall population of the crisis. On to therapies. Can therapies, alternative approaches to health? As explored earlier, we can see that health and illness are dominated by the biomedical model, based on a scientific process. However, the change from the medical profession in recognising a link between mind and body has seen a shift in balance from the biomedical to the more social model of health. Growing consumer choice in health matters and the postmodernist views of health all come together when looking at competing views of complexity and alternative medicine such as therapies, including yoga, Reiki, reflexology, osteopathy, acupuncture. The use of CAM therapies is increasing in the UK, despite little evidence to support effectiveness. What might CAM therapies be used for? Massage for fatigue, acupuncture for back pain, headaches, migraines, hydrotherapy for fibrilloma, Reiki for insomnia and depression, herbal medicine for massage, PTSD. Research carried out to identify CAM therapies' main users found more than half the population use some alternative therapy. Athletes, terminally ill patients, specific culture groups. Looking into more details, we see the role of preventative healthcare in the past 30 to 40 years. Healthcare has included health promotion and prevention, healthcare attempting to keep the population healthier and save money. The integrative medical wheel. This is a practical tool for introducing integrative medicine to healthcare practitioners and the general public. Research showing that integrating multiple forms of medicine can be more effective than relying on any single approach. Cancer patients receiving chemotherapy have reduced side effects faster, had faster recovery, and improved survival rates when combining these treatments with massage, mind, body, and medicine. In looking at the CAM therapies from a psychological view, there is a range of research offering different perspectives into CAM therapies carried out by ASCA in 1986, comparing the traditional CAM views. For health, biomedical view, and absence of disease. CAM view, balance of external and internal forces. Disease. Biomedical, specific biological issue of organ or tissue. The CAM view, a body-wide issue. Diagnosis. biomedical, using specific testing to identify a cause of disease. Can view, treatments usually aim to strengthen life forces. Therapy, treatments aim to eliminate or suppress the cause of disease. With CAM, treatments usually aim to strengthen life forces. And the patient, with the biomedical view, generally gives on a passive role. The CAM view, the patient generally takes on an active role. Health and illness. Are they a social construct? I'd like to summarise my presentation. Health, to me, is a social construct, a relative concept varying with age, circumstances, culture and lifestyle. What counts as health to you might not count to your neighbour. It is a social construct, a product of social and cultural interpretations, many we have looked at throughout my presentation. Illness? Yes, another social construct. It's not simply feeling poorly, it's the surrounding experiences that make you sick. Illnesses are categorised in our culture, the sick role signed off by medical professionals with many chronic illnesses just not recognised. The ideas we have around health and illness are constructed through social factors such as the media, government, celebrity culture, social media, and tell us how we should feel, act, look, think, react, how fit and healthy we should be. When we watch the next government briefing on coronavirus, will we again see a shift in the communication tones from the Prime Minister? Will we now be told we are safe, we have won the fight? Will COVID have retreated? Maybe when looking back on the social construction of instructions and information from March 2020, the future media might attempt to provide less sensational information to enable us to engage with our own beliefs that what is best and not be so affected by the media. Thank you for watching my presentation.